we are different heights. All the men are black, all the women are white, it seems. I'll add all the cities are urban, the problems self-inflicted. Jada, not her real name, of course, came to the awareness of the Children's Defense Fund and Southern Rural Black Women's Initiative when she was 14. She's the fourth of 14 children and had taken the day away from being caretaker to her sisters and brothers to spend some time at a conference about education reform and the cradle to prison pipeline. The more she heard, the more confused she got. She raised her hand to speak. In her mix of the King's English, Southern accent, Black dialect, and Ebonics, yes, I'm proposing there's a distinction, she said something like, I just found out because of the tests we took at the end of the school year that I read on a 4th grade level because I'm dumb and I ain't know it. I make good grades, I help my friends and sisters and brothers with their homework. You see, Jada is a doer and isn't encouraged to think critically like many of her peers who pushed their way through the broken public school system. The schools aren't broken because they're public, by the way. Mississippi schools have been underfunded $1.7 billion in the past 7 years. We can start there. Yeah, no time to get into that. Anyway, the one sentence that rang the loudest of Jada's testimony was, "Who let this happen to me?" Some of the folks in the room and in her community blame her mom. Women, black women, particularly those of us who live in the rural South, get blamed for a lot of things. People make bad decisions, we all do, but poor people's bad decisions are almost always costly ones. By the time Jada's mom was pregnant with another child, working her low-paying job got more difficult. It started not to make financial sense. Putting gas in a hoopty a few times a week, driving 50 miles round trip for a minimum wage earning job that's $7.25 in Mississippi isn't exactly cheap. Then paying for childcare got expensive. Did I mention there's hardly any industry nearby? Machines stole most of the big agriculture jobs, all that having gone overseas. That devastated the town of 200. We'll be talking specifically about Bolivar County, Mississippi, where the Jadas live. Bolivar and 8 other counties are highlighted in Unequal Lives, the state of black women and their families in the rural South. Bolivar County is 66% black. That's 22,500 black folks, of whom 18,000 are black women. 86% of the black population, that's 19,350 black faces, live stories, living in poverty, of which 70.4% are single women with children. Once the car broke down and cost more to be fixed than it was worth, paying to be driven to work cost too much too. There's no public transportation. Public infrastructure like that in rural areas is never. There is none. So Jada's mom quit. She had to make a way to feed and clothe the children she already had. Food stamps helped tremendously. 30% of people in southern states and counties like Bolivar receive SNAP benefits. So food is taken care of, but what about the other things? Contrary to a myth that far too many people spread, only 2.3% of people are on welfare. So how do you pay rent, utility bills, buy things the kids need? You need clothes, HUD vouchers, hustle, sell food stamps, and thank God a lot of the children wear the same size. You wear those jeans today, I'll wear them tomorrow. I live in Jackson, Mississippi, the capital of the state. The city has its problems, but I work and spend lots of my time in the Mississippi Delta, Black Belt of Alabama, and Southwest Georgia. These places, if you've never been, are difficult to describe. They're a little third worldy, and I don't say that lightly. About 20% of America is rural. And though I live in Mississippi, before coming to this work, when I heard the word rural, I thought of people who lived in Nebraska or Montana or some other place hardly anyone else lives, no shade. Black rural people are often forgotten until it's time to complain about how they're doing it all wrong, and poor people are always doing it wrong no matter what it is. Jada's mom isn't alone. The poverty rate for households headed by single black mothers in rural counties is 3 times that of households headed by white women with children. But this isn't just a matter of birds of a feather flocking together. In the rural South, poverty is more distinct than in metropolitan areas, and in some places is more than 50% higher. Why won't she just quit having babies? Besides the fact that that question is intrusive and bubbling over with rudity, it's the wrong question. It's so easy to focus on individuals, but complex thinkers focus their attention on systems and instead ask about healthcare options. Less than 1/3 of rural women live within a 30-minute drive to the nearest medical care facility. It takes more than 80% of them more than an hour's drive. I hope it's already crossed your mind then that you only go to the doctor when you must. Let's suppose you're fortunate and transportation isn't an issue. Let's take it a step farther and say you have Medicaid. There's no Medicaid expansion around our parts, of course. We don't believe in handouts in the dirty, dirty South, except, well, we don't have time to talk about that either. Medicaid pays for a doctor visit. You get a diagnosis, but what good is any of that if you can't afford the medicine? Talk about it. Why bother? Death isn't always physical. Sometimes it's slow, steady punctures to your emotional well-being when hope is a word used flippantly. Its roots are loosely tangled in topsoil, not reaching for the subsoil below. Other times it looks, smells, and whispers like love until your pseudo-liberation has wrapped its fingers around your neck, strangling you and robbing you of your life's abundance. When I started working with Jada one-on-one, she came to me as a 16-year-old participant in the UNITA Blackwell Young Women's Leadership Institute a program I direct that focuses on rural young women between the ages of 14 and 24 across the 3 states. I learned a lot more about her life, like she lived in an abusive household. Her mom's boyfriend, who found legit work every blue moon and sold drugs sporadically, and as Jada put it, got a temper problem, was the man of the house when he was there. She and her siblings had spots around the house. I lost count at about 6 when I went to visit, and she pointed them out to me. What's a spot? They're the places the children hid things that could be used as weapons in case the boyfriend got out of hand. See that hole in the couch? If you put your hand in there and you lift up, there's a hammer. It's a wonder he didn't know about the spots. Maybe he did, I don't know. 20 people living in a 2-bedroom apartment. Jada, her mom, her 10 sisters and brothers, 3 of them had gotten jobs and moved to other cities. The boyfriend, one of her sisters, had 2 children, and Jada's aunt and 3 children. The aunt had just lost her place not long ago and had nowhere to stay. There aren't any homeless shelters in rural areas. So homelessness is sofa surfing in overcrowded places and the occasional person sleeping in the kitchen when need be. Just as there are no homeless shelters, there's only one shelter in the Mississippi Delta that's 18 counties that works with people who've experienced domestic violence and or sexual assault. You know what else there isn't? Data. Nearly 5 million women nationally experience intimate partner violence and rape every year, research says, but hardly any of those numbers come from rural communities. The Jadas and their counterparts across southern rural areas are navigating the world with trauma as traveling companions, depression bedfellows, and tall walls protect vulnerabilities and make sure that joy is virtually impenetrable. No, there are no therapists. Thank God for foundations. Kind of. D for effort when it comes to Black women in the rural South. More money, more problems. We wouldn't know anything about that. Not these kind of problems. In 2012, foundations invested $4.8 billion across the 17 southern states. Most of that found its way to institutions of higher learning. In Bolivar County, 33% of Black women have less than a high school diploma or GED. The arts, there are no arts outlets in these community hospitals. There are 22 hospitals designated for closure in rural Mississippi in 2016, and other large institutions that rarely directly impact the lives of Black women and girls. Less than 1% of the $4.8 billion spread across 17 states was for programming specifically for Black women and girls. Bless our hearts, or should I bless theirs? I'm starting to think I can be somebody, Miss Natalie, do you? In the past 10 years, the leadership program has worked with more than 1,000 young women. In the past 5 years, 100% of these Black girls have graduated high school. More than 80% have gone on to a 2 or 4 year college or trade school, and there's a less than 5% teenage pregnancy rate. To see these girls go effortlessly from conversations about intersectionality to whipping and nay-naying, that's a dance, is a sight to see. No, don't stop paying attention to men and boys of color. No, don't stop focusing energy on the important work that you're doing in urban areas. And please don't walk away saying I said Black women are more important than any other kind of woman. Though all the women in my family are Black except Rachel, who married in. Shout out to Rachel. But I beseech you to stretch your capacity and consider those who are too often never seen or heard. Rural Black women. As Fannie Lou Hamer, I'm almost finished, Asia, from rural Mississippi, a town a couple counties over from Jada, said, whether you have a PhD or no D, we're in this bag together. And whether you're from Morehouse or no house, we're still in this bag together. What do we need? Increased and targeted philanthropic and other investments, a stronger infrastructure. Did I mention only 59% of people in rural communities in Mississippi have access to broadband internet? We need increased research and data collection and around Black girls and women and the issues that impact us directly. I didn't even talk about the issues of housing, criminalization, queer women, or those living with STIs and disabilities. There's no time, but you can contact me directly and we can have a fuller conversation. I love talking about stuff like this. Jada's not sharing her clothes anymore. She's hours away from her family now. I got a picture of her. She's sitting on her twin bed at the college where she's finishing up her first semester as a freshman in college. Getting there was a long, twisty road. There are bouts of survivor's guilt. Though she's not completely out of the woods yet, her family is happy for her, but they miss her. They're scared for her to fail, and they're nervous about what her succeeding means for them. I've tried to convince her she can do more for her family by being away from them for a few years than being there, but this is a conclusion she'll have to draw for herself one day. Until then, I can only keep working, and I hope I've compelled you to consider, though there are systems, institutions, barriers, and woes, as Hull, Bell Scott, and Smith proffered, some of us are brave.